Okay, let's just jump right in because what we're talking about today, it sounds like something straight out of a science fiction movie, but I promise you it's very real. We're going to break down how surgeons can rebuild a person's jaw by using a bone from their own leg. It's an absolutely incredible story of medical innovation.
So let's start with a basic problem. Just imagine for a second that someone loses a major part of their jaw, maybe from cancer or a really bad accident. How in the world do you even begin to reconstruct something so complex, so essential?
And this is where it gets really mind-bending. The raw material for that brand new jaw often comes from the most unlikely place, the patient's own leg. Yes, you heard that right. A leg bone becomes a new jaw. So how is that even possible?
Here's our roadmap for this explainer. First, we'll talk about why the jaw is so critical in the first place. Then, we'll see how surgeons found the perfect spare part. We'll walk through the amazing surgical process, dive into the delicate microsurgery that makes it all work, and finally, look at the life-changing results. All right, first up, the problem. To really appreciate how amazing the solution is, we first have to understand the massive role of the mandible. That's your lower jaw. You know, the jaw is so much more than just a bone. It's fundamental to who we are. It lets us speak, it lets us eat, but it also literally shapes our face. It's the foundation of our appearance. Losing a piece of it is just devastating, not just functionally, but emotionally too.
So, presented with this incredible challenge, how do surgeons solve it? Well, they had to find the perfect spare part, and the solution comes from a truly unexpected place. The official name is a fibula-free flap. Now, that sounds super technical, but the idea is actually pretty brilliant. Surgeons take a piece of the fibula, that's the thinner bone in your lower leg, and they carefully detach it with its own personal artery and vein. It becomes a free little bundle of living tissue ready to be moved. So why the fibula? Why that specific bone? Well, it turns out it's kind of like the body's perfect built-in donor bone. It's long, it's straight, and it's strong. And crucially, it has its own dedicated blood supply. But here's the amazing part. You can live just fine without a piece of it. It doesn't carry much weight, so patients can still walk normally after the surgery. It's just the perfect candidate. This brings us to the surgery itself, and it's a true masterpiece. The surgeons here are acting less like doctors and more like, well, architects of the human body. The whole thing really breaks down into three key phases. First, there's the harvest, where they take that segment of bone and its blood vessels from the leg. Second, and this is the really cool part, they sculpt it. They actually make precise cuts in the straight bone to reshape it, creating the gentle curve of a natural jaw. And finally, they secure it, fixing it into its new home with tiny titanium plates and screws. This quote from one of the sources just nails it perfectly. It's not just a replacement, it's architectural reconstruction, but on a biological level. It takes an incredible amount of precision and artistry. But, sculpting the bone is only half the battle. Now we get to the most delicate, the most critical part of the whole operation, connecting the lifeline through the miracle of microsurgery. Now, listen, here's the single most revolutionary thing about this procedure. The new jaw isn't just a dead scaffold. For it to heal, for it to truly become part of the body, it has to be a living piece of bone. And for any tissue to live, what does it need? A blood supply. So how do they pull that off? The surgeons have to plumb the new bone's blood supply into the existing network in the neck. And the vessels they're connecting are just 1 to 2 millimeters in diameter. To put that into perspective for you, that's thinner than a typical coffee stirrer. We're talking about microscopic plumbing here, and it requires immense skill and a rock-steady hand. So to make that final critical connection, surgeons work under a powerful microscope. They use sutures that are thinner than a strand of human hair, and they painstakingly stitch the tiny artery and vein from the fibula to the vessels in the neck. And the moment that connection is made, blood flow is restored, and the new jaw literally comes to life. So, we've gone through the incredible technique. But what about the outcome? This final section is about how this procedure rebuilds so much more than a jaw. It rebuilds a life. The result really is nothing short of extraordinary. The patient has a new, living, and functional jaw. A jaw made from their own leg bone that allows them to do all the things we so often take for granted. To eat a meal, to speak clearly, and to smile with confidence again. So, let's just quickly recap the key takeaways here.
A leg bone, the fibula, can act as the perfect spare part for a new jaw. That bone is then surgically sculpted to fit. But the real magic happens with microsurgery, which provides a blood supply to keep that new bone alive. And the end result is the restoration of functions that lets someone live a full life again. This procedure is just an incredible fusion of biology and engineering. It really shows just how far we've come. And it makes you wonder, doesn't it? If we can rebuild a jaw from a leg bone today, what part of the body will we learn to rebuild next?